In my previous video, I talked about breast engorgement, what it is, when it occurs and why, and also the signs and symptoms. In today's video, let's dive in how to care for an engorged breast. Number one, what you want to do is to breastfeed, because that is one of the most ways that the milk will keep on, coming, so that it adjusts to your baby's needs. Ensure that your baby is latching properly on the nipple, because if they're not latching properly, it means they're not feeding, and that might worsen the situation. You want to breastfeed the baby on both breasts. Don't do one, do both. Before you breastfeed, you can sparingly squeeze out some milk just to prepare that nipple for feeding. I told you that the nipples tend to flatten sometimes, so you just want to signal it that it's time to breastfeed. There's a way it reacts when you touch it during that breastfeeding period. So that's that. You want to apply warm compress on your breasts, right, to just ensure that it's milk let down. That is before feeding, and after feeding or between feeds, you want to use cold packs on your breasts, okay, so that they can be able to reduce the swelling and the pain. Ensure that you are wearing a supportive breathable bra. Please, let's avoid these underwire bras during that time, because they can block ducts. And let me tell you, when your ducts are blocked, forget that engorgement pain. I'm telling you, it's gonna be painful. Don't say I didn't tell you. So make sure our bras are very breathable and comfortable. You can use painkillers, of course, when directed by a healthcare provider, just to ease the pain. Now, if you're not planning to breastfeed, what the primary goal is to ensure that we are not stimulating the body to produce milk. So what are we going to do? We are going to avoid nipple stimulation, right? We are not going to pump milk. We are not going to hand express, because these things, they signal the body to produce milk. Use cold packs, but not warm compress. Anything warm that is or anything heated when used on the breast during that time is going to encourage milk let down. So we don't want that. Of course, there are medicines that are used to stop milk production, and of course painkillers, but you are only going to use those if you are advised by a healthcare provider. Now, when do you see this healthcare provider? Number one, if the symptoms we talked about in our previous videos, they become persistent and consistent, or they only appear in one breast. You start feeling feverish, okay, and then you also develop symptoms that are flu-like. You feel something lumpy in your breast that is warm, hard, and if that area is red. Now, if you've learned something, why don't you like this video and follow me for more Nurseledmotherhood tips?